Bipolar disorder is a mental health condition where someone experiences extreme changes in mood, energy, concentration, or the ability to do everyday tasks. In this video, we'll explore what bipolar disorder is, the different types of bipolar disorder, and their symptoms. It used to be called manic depressive illness or manic depression. A common chain of events in bipolar disorder is a manic episode followed by a depressive episode. A manic episode is when you experience extreme happiness, focus, and or physical output, like doing a large amount of writing in a short amount of time. A depressive episode is the opposite. The symptoms of a bipolar depressive episode can be similar to the symptoms of major depression: extreme sadness, hopelessness, lethargy, a loss of interest in life, emptiness, anger, irritability, frustration, feelings of worthlessness, and guilt. Sleep disturbances, exhaustion, and anxiety are also common. Other symptoms of a depressive episode may include trouble concentrating, body aches, or thoughts of suicide. Last, a change in appetite, eating more or less, could be part of bipolar. The disorder looks a little different for each person who has it. There are 4 types of bipolar disorder: bipolar 1, bipolar 2, cyclothymic disorder, and unspecified bipolar disorder. Bipolar 1 is the most common. It involves at least one manic episode that lasts at least 7 days, or one that has severe enough symptoms that hospitalization is needed. A depressive episode may or may not be part of someone's bipolar 1 experience. Bipolar 2 is when someone shifts between lower grade manic episodes, known as hypomania, and depressive episodes. This condition does include the manic episodes as seen in bipolar 1 disorder. Cyclothymic disorder, also known as cyclothymia, is when someone has consistent changes between hypomania and depression for more than 2 years. The big difference is that the episodes are usually less severe than with bipolar 1 and 2, and they don't match the criteria for a bipolar diagnosis. Phases of normal moods may be a part of cyclothymia too. Symptoms may be present for days at a time, but they last for less than 8 weeks. The last type of bipolar disorder is called unspecified bipolar disorder. This is when someone experiences manic episodes but does not match any of the above diagnostic criteria. Their episodes may be too short and or too mild to be considered bipolar 1, bipolar 2, or cyclothymic disorder. The key takeaway here is that bipolar, in whatever form someone experiences it, is a challenging disorder with many factors at play. If you or someone you know is experiencing symptoms of bipolar, speak with a physician about potential risks and treatments.